Hi, I'm Dr. Wendy, aka Dr. Every Woman, and I am back. And you know what we're doing? Taking off the white coat. So now that my white coat is off, let's just talk. Today, I want to talk about what happens if your Pap comes back abnormal. So first thing I want you to know is you don't have cervical cancer. You do not have cervical cancer. If you are getting your Paps, you won't get cervical cancer. So an abnormal Pap does not mean you have cervical cancer, but it does mean that there are some cells on the cervix that need to be evaluated further. So there are various stages of abnormality on a Pap. The cells can demonstrate any of these following levels of abnormality. Atypical cells is one criteria. Low-grade squamous intraepithelial lesion, LSIL. Moderate grade squamous intraepithelial lesion. High-grade squamous intraepithelial lesion, HSIL. And then there's carcinoma in situ, and then there's cancer. And so typically it's in that order, right? You can go from normal cells to atypical cells to low-grade cells, high-grade cells, cancer. And I know I said moderate, but moderate is considered high-grade as well. And so if you have any of those values, the next step is always going to be something called a colposcopy. A colposcopy is where we take a colposcope and actually examine the cervix under a magnifying device. And that's because the Pap is a very random collection of cells. It's a brush that just randomly selects cells. It has no eyes. It has no localization of what it's collecting. But a colposcopy is your doctor's eyeballs. They're looking through a scope and examining that cervix after we put a solution on it. It's acetic acid, but it's also just white vinegar. So we call it acetic acid, but I'm actually telling my patients it's acetic acid because who wants to think that their cervix has acetic acid on any kind of acid? Just sounds bad, right? It's white vinegar. And that changes the cells to a color that we can see them. So let's break that down. Since we're here, let's get into it. So when the cells are normal, if you think about a cell structure, it's got the cell wall, it's got the cytoplasm, liquid inside, and all the little razzle-dazzle within the cytoplasm. And then it's got the nucleus. The nucleus is like the main core of any cell. It's got the DNA and all the things. Have normal cells sizes and normal size small nuclei on the inside. Well, when the nucleus of a cell starts to enlarge within this context of cervical cellular abnormality, that is an abnormal cell. And the bigger the cell nucleus is, the more abnormal it is. And so when we put vinegar or acetic acid on the cervix, it actually dries out the cells. It desiccates the cells because there's electrolyte changes and it makes the cells, the water, the cytoplasm become less within the cell. And so then proportionally, the nucleus is bigger. Okay, so when the nucleus is bigger within the cell, that cell is going to reflect more light. So suddenly, as I'm shining this light on the cervix, it is lighting up more if the nucleus is bigger than if the nucleus were smaller and it just didn't reflect that light. So those cells turn white. That's called aceto-white changes. Acetic acid now changing the cells to white, and that's a change. So that means that the cells that I'm seeing that are light or that are white are the cells with the bigger nuclei. So aceto-white changes occur at the level of the cervix. And that tells me if that's an area that needs to be biopsied. There are also other signs like mosaicism or tile-like appearance of the cervix or abnormal blood vessels. There's a lot of different things we can see on colposcopy to determine if we need a biopsy. But that's why we do a colposcopy, because now we want to see where on the cervix is there something abnormal and is it consistent with what the Pap picked up, or did the Pap get the best of things or the worst of things? Like, is the Pap correct or not is what the colposcopy is for. So once we do the colposcopy, once we see what needs to be biopsied, various providers do different types of biopsies. I biopsy with a brush, a spiral brush, which actually rubs the cervix and collects cells. I used to biopsy with something called a Tischler, which would actually grab a bite of cells. That was a little bit more uncomfortable. The spiral brush gets a good amount of cells without needing to do that bite, but it's often dependent on what your provider has access to. So it's not like you can really walk into a gynec office and say, do this kind of biopsy or not that kind of biopsy, but just know that typically some sort of biopsy is taking place. And I think it's reasonable to ask your provider what kind of biopsy they would do if they need to do it. This is also, by the way, kind of a litmus test for your provider. So if you ask your provider, hey, I know I need a colposcopy. One, Why do I need it? What are the cells showing? How abnormal are they? And if you say, hey, what kind of instrument do you use if you need to do a biopsy? They're like, don't worry about it. Just come in and do it. This is not somebody who is willing to explain things to you. This is not somebody who I think is communicating as clearly as they need to. And I don't want to throw my fellow OBGYNs or family practice or any kind of mid-level providers under the bus, but I do think it is reasonable for you as a person who has a body, who has a cervix, who has these parts, to know what's about to happen to them, to understand what it feels like or what it will look like to potentially take a sample. So I'm willing to share that information with any of my patients who ask, or if I can have the opportunity to just volunteer that information. But if your provider is not willing to volunteer that information or to answer your questions, that might not be the provider that you want doing this evaluation, because how well are they going to explain to you the results? How well are they going to communicate to you what's going to happen? You don't need to be surprised. My motto as a gynecologist is no surprises. You should never be surprised or shocked with what I'm doing to your body. I should be able to tell you what's about to happen, and you should be able to say, okay, that's what she just said. You know what I mean? Give or take, whatever your body experiences that I can maybe predict and maybe cannot. So anyway, that's a colposcopy. Stay tuned. I'll talk more about a leap in another video. Healthcare is a weird place where some providers have time and space to share as much as they can, and others, just based on even sometimes the logistics of how they practice, they may not have the time to really break some of this down. So hopefully you found some value in this video, and like, subscribe, tell a friend, and as always, visit your local friendly gynecologist.